In today's video, we're going to answer the question, what is the best options out there when it comes to health insurance if you have pre-existing health conditions? Conditions such as diabetes, high blood pressure, CHF, whatever the condition you may have when it comes to your health, what is the best health insurance options for you? Okay, so the first option would be employer's health insurance, right? So if you're working and you have a pre-existing condition, you don't have to worry about being denied of health insurance because of health conditions. You could enroll in your employment plan during the open enrollment period. The second option is marketplace health insurance, also known as Obamacare. Obamacare is a great option because there's no underwriting or anything like that. They don't ask you anything about your health. You don't have to worry about being denied because you have diabetes or high blood pressure or you're on insulin or anything whatsoever. You don't have to worry about pre-existing condition. Now, if you have a short-term medical plan, this definitely can be an issue, right? So a lot of times with these short-term medical plans, they would not cover pre-existing. So that's why Marketplace, also known as Obamacare, is a great option if you have pre-existing conditions. So that's what we're going to talk about in today's video, how to enroll and all of that. So first off, how do you enroll in Marketplace health insurance plans? You could call the Marketplace 1-800 number. You could also call our office as well. We'd be more than happy to assist you. We have hundreds of clients that is enrolled in Marketplace health insurance. One of the really nice perks of Marketplace, besides the fact that you don't have to worry about pre-existing condition, is that they also have subsidies. So the government can subsidize your monthly premium based on your income, which is really nice. A lot of our clients have 0 monthly plans. Yes, that is correct. A lot of our clients pay 0 per month for their insurance plan based on their income. And the great thing about the subsidy, depending on your income and what you qualify for, it can lower your max out of pocket, it can lower your deductible, your co-pays, and your co-insurance as well. So instead of having a high max out of pocket or a high deductible, all that can be reduced based on your income, based on that subsidy. So that is really nice. It is called CSR, which is cost sharing reduction. So if you see that CSR when you're applying via Marketplace, that's what that means, that you qualify for the cost sharing reduction. And like I said, it will lower your out-of-pocket expense overall. Now, some individuals, obviously income is a little higher and you will have a higher max out of pocket or a higher deductible. But what we like to do with these clients is we like to enroll them in the Marketplace plan, and we like to add something called a plan enhancer. If you qualify for a plan enhancer, what it would do, it would pay for your hospitalizations, accidents, and such. So if you have a max out of pocket of $9,000, let's say, and you end up in the hospital and you have, like, let's say you had surgery, you had 2-3 nights in the hospital, well, the plan enhancer will write you a check for $9,000. So that max out of pocket is covered with that plan enhancer. So we like to do that. So that's something that you definitely want to consider. And the great thing about a plan enhancer is that it is very affordable because it's not major medical coverage. It is an enhancement to your health insurance. So basically, like I said, it will cover accidents, surgeries, and hospital stays. So it's really nice to have a plan enhancer plan in place if you do have a plan that has a high max out of pocket. Now let's talk about the 10 essential benefits that is covered under Marketplace insurance, also known as Obamacare. Okay, one of the essential benefits that's covered by Marketplace health insurance is outpatient services, ambulatory services. So if you need services outpatient, then that would be covered under Marketplace health insurance. Another thing that is covered is emergency services. So if you have to go into the ER, urgent care, and such, that is covered under marketplace health insurance as well. Hospitalization is a given one. If you need to be admitted to the hospital, you have to stay there overnight. Also covered under marketplace. Maternity and newborn care, which is really nice because it covers the whole pregnancy and newborn care. So after giving birth to that baby. So that is really nice. Covered under marketplace. Mental health and substance abuse disorder is also covered under marketplace health insurance. So if you're having problems with substance abuse, marketplace is a great option to help you get over your addiction. So that is really nice. Prescription drug coverage is also covered under marketplace. So if you're on medications for diabetes, or you have to take insulin, medications for high blood pressure, of course you definitely want to make sure that your particular medications is covered and it's in the plan's formulary to make sure you know the tier of the medication and the cost of your drugs, your co-pays and such. But prescription drug coverage is covered with marketplace. Rehab services is also covered under marketplace. So if you need physical therapy, speech therapy, occupational therapy, say after having a stroke or an injury or sports or anything in that nature, you know that you are covered when it comes to physical therapy under marketplace plans. Laboratory services is also covered under marketplace as well. If you need to get blood tests done, any type of diagnostic procedures and such, covered under marketplace. Preventative care, wellness services, and managing chronic conditions is also covered under marketplace. And most preventative care is covered under marketplace as well. So it's really nice that you can get your vaccinations, your flu shots, mammograms and such. All of that preventive care is definitely covered under marketplace plans. And the last thing is pediatric services. So when it comes to taking care of your kids, also covered under marketplace. And pediatric services does include dental and vision care. So those are the 10 essential benefits that must be included under marketplace health insurance plan. These 10 essential health benefits make marketplace considered as major medical. And major medical is exactly what you need when you have pre-existing conditions. So if you have pre-existing conditions, marketplace health insurance plans is definitely a great option. And yeah, so I definitely recommend marketplace health insurance if you need healthcare. Okay. Thank you so much for watching this video. I hope I made it really clear why you should definitely go with marketplace if you have pre-existing conditions. If you like this video, please give it a thumbs up, share this video with a friend, and subscribe to the channel. If you need any assistance, give our office a call. We'd be more than happy to assist. Bye.